Hello, and welcome back to the Healthy Hour podcast. I'm your host, DQ, and I'm joined with my co-host, Andrew.
Hello, everyone.
And we are excited to dive into today's episode where we will be introducing two amazing guests that will be discussing various topics related to Black maternal health.
So buckle up and join us as we embark on this captivating journey to expand our knowledge and understanding of Black maternal health. And if you enjoy our show, please consider subscribing to our YouTube channel, following us on social media, and sharing with your friends. So let's get it started. Our first guest that we'll be featuring on the Healthy Hour podcast is Chloe Vitale. She's the creator of a nonprofit organization called MidHudson Chocolate Milk that was established in 2018.
So please welcome our first guest on this episode of the Healthy Hour podcast, Chloe Vitale.
Thank you so much for having me on the podcast. I really appreciate you highlighting and amplifying this topic.
Chloe, we're so happy to have you as our guest, and we're interested to hear about your journey with creating your business, MidHudson Chocolate Milk. Can you tell us how you started your business?
So MidHudson Chocolate Milk started because with my first son, I had a conventional hospital birth. And when I say conventional, I mean everything went according to plan. I was healthy. My son was healthy. I got to take him home after 2 days. And I was so excited with my breastfeeding journey. I was like, okay, I'm going to help people in that capacity, express milk. Then my second son was born at home. And it was so transformative, understanding in such an intimate way the concept of autonomy and really listening to my body, tapping in and trusting my support team. Even like my oldest son was there, and he's 2 years old, and he's not bugging out because I'm not bugging out. I'm leaning in, I am being present to the experience. And for me, that was like the light for me with MidHudson Chocolate Milk, because there are so many resources and agencies that are dedicated to perinatal support in whatever capacity. But for what we do, it was really about understanding the vulnerability of the experience. And that happens with any and every pregnancy. I don't tell people, you have to have a home birth to happen. No, your baby could be born premature and you still can be in this space. You can experience a loss and still be in this space because it's about the vulnerability. And pregnancy offers such a, magical time for that. But what we really hope ideally is that people take that practice, they call it restorative reclamation, and understanding their experiences as tools and use that moving forward. So that's kind of like what I was talking about with the parenting style. Just understand, we're crafting this tool the entire time we're going throughout this relationship or engaging this pregnancy. And if we're not mindful, then, we're sharpening tools that we don't even need, or we're sharpening tools that don't even help our family, or we're hurting ourselves, and it's such a powerful experience that most people go through. We take for granted in that way as a medical event. So just really helping people understand that this is a journey for themselves and for their support system, and connecting the dots in the way, because we don't like to be everything to everybody, right? So one of the great things that we do get to do is collaborate and connect with those existing perinatal resources or different initiatives that are going on, because it's about continuums of care, not just, oh, I'm here to give you this. We want these parents and families to know love is the standard and you deserve layers at every stage of your going through.
Chloe, it's amazing to hear the origin story of MidHudson Chocolate Milk. After hearing how you started your business, our audience would love to learn more about its purpose. Can you tell us more about the core mission of MidHudson Chocolate Milk and what impact you hope to achieve through your business?
So the core mission, as I said, is really helping people develop a healthy relationship with autonomy and really strengthening certain concepts within themselves that they already possess, whether it be intuition, intention. We hear those buzzwords like manifestation a lot nowadays, right? And everybody's like, oh, you can manifest these different things. But it's just we don't really understand that that's what the pregnancy was. You know what I mean? Whether it was intentional or not, you were in that space where you created a person. And understanding the journey of that, how that comes to fruition, is such a powerful process. So it's really important for us, for people to get comfortable with the concept of what a journey even is, right? Because, and I'm paraphrasing, but there's a great quote by James Baldwin where he talks about a pilgrimage is like a religious thing, right? And a funeral is you're honoring your dead. But a journey, you don't know where that's going to end up. And surrendering is such a powerful thing. and helping the expectant parents and their support systems surrender in a healthy way. And that's what the biggest thing about autonomy, right? Because we want to be able, when one doctor tells us one thing, right, I want to feel comfortable saying, well, you know what, that doesn't sound right. I want to go get a second opinion. Not saying, okay, well, I'm just going to do what they want me to do. Really saying what feels right with me, discussing with my partner, and then bringing that forward. As I said, like really developing that parenting style. Short term, of course, we want healthier birthing experiences and longer lactation rates, right? More lactation engagement, and especially in the Black and Brown communities, because of a lot of the work that we're seeing is that culturally, Black and Brown communities are struggling with the concept of autonomy when engaging the concept of whether it be advocating for themselves or engaging in like breastfeeding or milk expression. So really understanding having a healthy relationship with their breasts versus seeing them with their perceived notion. And that could be for a multitude of reasons that, someone hasn't breastfed in the family for generations. Big thing we see is survivors of sexual abuse and trauma. My partner thinks that that's inappropriate, or my religious beliefs tell me that I'm not supposed to be engaging in certain things. And what's so important in the work that we do with maternal mental health is understanding that all of that not only plays a role, but it's such a valid and legitimate experience. And really honoring that person's experience. And once again, that practice of restorative reclamation and saying, okay, well, you're saying that all your life you've been told these are sexual objects, right? But you feel that this is best for your child. So how can we put you in a position where you might feel comfortable with that? And I've had parents, come into a workshop saying, well, I just want to know what to do with my milk and I'm going to give my child the bottle. Boom, that's fine. We're going to tell you how to do that in a healthy way so you don't get stressed out, so you don't get engorged, so you don't develop mastitis or infection. And a lot of times what happens is that the parent surrenders to the experience and ends up latching their child anyway. They had the tools because they engaged in the education, but they weren't spiritually or emotionally comfortable and aware of themselves. Since they allowed themselves to be present throughout their pregnancy, throughout their birth, and in this postpartum space, and it gives them that opportunity to really see what their strength is. And it's so important when we are talking about like the long-term goals. The family dynamic is essentially the long-term goal. The vulnerability of the parental experience plays such an important role in how people parent, whether it be the stressors that they've endured during pregnancy or as a parent, being a single parent, or just even nowadays in the midst of things costing so much. There's so many different factors that play a role. And having a person develop a healthy relationship with autonomy gives them that opportunity to be authentic in how they're navigating it. Because I can't stress enough, we tell the parents all the time, the power of presence is divine timing. And you being in that space where you're saying, okay, I am acknowledging everything. I am aware of where I stand. I am going to be responsible for how I engage this experience. Having that type of mentality is more powerful than just saying, well, I have a doula in this space, than just saying that, oh, I was able to have tea lights in the room. Because moving forward, dad's going to have that better relationship with mom, knowing that he advocated for her, right? And mom's going to feel heard and respected for the work that she did, giving birth to this child. And she's going to feel more comfortable being a mother. She's going to feel more comfortable honoring those child's needs. Because the big thing that we don't understand that the emotional hardwiring of our brain is done between 0 to 5. So even while baby is in the belly, the wiring of how we navigate emotional situations as an adult is done. So giving parents that opportunity to understand that, right, and be comfortable with that gives the child the best opportunity for that healthy emotional development.
First off, thank you for breaking down your core mission into the short-term and long-term goals, because it's more easier to digest that way. And I'm pretty sure the audience will definitely enjoy or appreciate the fact that you're breaking it up in that manner. And again, with the information that you're relaying, it's very important because when people are listening back to this, you don't know what situation they're going to be in, and you explaining the process of the journey and the state of vulnerability, that's a lot to take in, especially for a new parent. I can tell you that I'm a little bit nervous, but you just have to go in there and just be able to provide for your child. But it's like once you're done, the whole process is over and it's time to go home. The doctors they just give you the child and it's like, what's next? So even with all the prep can sometimes just go out the window and it's just you're in your mind and having that outlet of information where you can rely on somebody during this process is very important. And you being able to have this business that can be effective when teaching parents on the benefits of breastfeeding and showing them how to do it properly is definitely beneficial. Moreover, we do appreciate you taking the time out to explain the core mission of MidHudson Chocolate Milk and the impact you hope to achieve with your business. It's definitely beneficial, as I just mentioned, and we just want you to be successful in helping people and reaching out to as many people as possible that may need your service. So thank you.
We also wanted to congratulate you on being selected by the Orange County Department of Health for Breastfeeding, Chest Feeding, and Lactation Friendly New York initiative. Can you provide some background about the initiative and the main goals you will be focusing on?
The premise of the RFP, the proposal, the initiative is to increase lactation engagement. So background, United States has the highest maternal and infant mortality rate of any developed nation, has the lowest lactation engagement rate of any developed nation. And those numbers are statistically 2 to 3 times higher in Black and Brown communities. So what the initiative wanted to focus on, right, was the barriers that some people face. So when I go back to work, is there adequate placing for me to pump, store my milk? Am I going to get the breaks that I need? If I am out in the public, right, are there safe spaces where I can nurse? And safe can mean that like enclosed, or will the owner of the establishment advocate for me if one of their customers come and, try to be an aggressor in the situation? Another part of it was starting a coalition, or we're going to be starting a coalition as far as what we propose, but some states or some areas, I should say, already had existing coalitions. So like investing in the coalition, but really creating support outside of just making it the responsibility of this new parent. A lot of the work that MidHudson Chocolate Milk will do, right, will be empowering this new parent and their family. And we've seen that, okay, we do that amazing job, and then this parent advocates, and then their providers just shuts it down. And now we have to be in this position where we're shifting and saying, okay, we can't just give them the information. We have to make sure that the information is being received. And we have to understand why the providers aren't receiving it, right? One of the things that we discuss a lot is, what is your relationship with your practice, right? Are you here to make sure babies are just here healthy? Are you here to make sure that parents feel comfortable? Are you here because you're a third generation OB? What is, your belief attached to this practice? And a lot of times when we engage in that type of professional development, providers get the chance to kind of reflect on how they are navigating and interacting with their patients. And that's incredibly important because, as we said, they're getting all this information, all these tools, these resources. Oh, here's the pump, here's the diapers, here's the bags, all these different things. And then you go to work and then you don't get a break for 6.5 hours. And then you become engorged and then your supply is affected. And a lot of times the conversation around supply is so important when it comes to the overall conversation with lactation engagement and retention, because a lot of people are saying, well, my supply is low, so my baby is not being fed. And we have to acknowledge how impactful that is for a parent to be experiencing that need for it to be symbiotic. The great part about this initiative is that the way we framed it, right, was we're going to be going into the communities a lot. And literally, so I'm going to be getting gift cards from a business that supports public breastfeeding. And then we bring gift cards to the expectant parents, right? And really building these bridges of resource. And that's something so simple that's going to be so impactful, right? Because now parents know where they could be in the community and receive support. And there could be congregating together and also supporting small businesses. All these different ways that we are understanding the relationships that we have with our community and how we are nourishing our community. And lactation just offers us such an amazing way to do that because it's a part of the biological function. And we're not confined to our biological functions, but it offers us such an amazing opportunity because it's a commonality.
Chloe, I have to say this was a very informative podcast episode for me. As being a new father and facing all of the new trials and tribulations of raising a child, it definitely gave me more insight and more information on how this process is going to be. And having you as an outlet and now connecting with you, I have the ability now to reach out to you at any given time or your company and get information about breastfeeding, because I know my wife wants to breastfeed. So I definitely enjoyed this podcast episode, and I definitely appreciated you being a guest on our podcast. So we really, truly appreciate you for coming on our podcast and spreading your knowledge and putting more information out there about your business and getting information out there so people know what's available to them.
Thank you guys so much for having me on the Healthy Hour podcast. It's been such a joy to be here, and I look forward to all the amazing work that will come out of this space.
Greetings. I'm Erin Ray Pasquaretti, and I'm an epidemiologist at the Orange County Department of Health. And you're listening to the Healthy Hour podcast.
And with that, we hope you've enjoyed the first half of our podcast episode thus far, because now we're going to explore Black maternal health in greater detail and discuss current health disparities in Orange County and provide more education and awareness on various topics.
Now let's welcome our next guest, coming to us live from Zoom, Dr. Beazer. Dr. Beazer is a board-certified obstetrician gynecologist and is currently a maternal fetal medicine fellow affiliated with Strong Memorial Hospital of the University of Rochester. So welcome to the Healthy Hour podcast, Dr. Beazer.
Thank you so much for having me. It's an honor to be asked to speak with you today about such important topics.
Dr. Beazer, as an OBGYN, having dedicated your career to maternal and women's health, we're curious to know what inspired you to this field and what keeps you passionate about it.
I officially decided to pursue obstetrics and gynecology when I was halfway through my clinical rotations during my third year of medical school. I wanted a career in medicine that allowed me to develop a rapport with my patients throughout the course of their lifetime. I also wanted a profession that would allow me to educate and empower women about their reproductive health. To be frank, my decision was made at a time when the political landscape of this country was at a turning point, which has actually drastically evolved over the past 7 years. I strongly believe women not only need their physicians to be astute practitioners, but also their advocates. My decision to pursue maternal fetal medicine, or more commonly referred to as high-risk pregnancies, occurred over the course of my second year of residency. I was the antepartum resident, and we had a patient who was transferred to us at the beginning of her second trimester. She was intubated, so she had a tube down her throat, assisting her with breathing. She was also sedated and had endured 3 cardiac arrests. Her story actually began because she was experiencing hyperemesis gravidarum, or severe nausea and vomiting during her pregnancy, and was continuously going to emergency rooms without much relief or help. She developed a severe vitamin deficiency that led to organ failure. Fortunately, after 1 month in the hospital, she made a full recovery and eventually went on to have a beautiful baby girl at term. I followed this patient very closely and had a front row seat to her hospital course and helped with coordinating multidisciplinary care for her. Her recovery required a lot of faith, resilience, advocacy, and patience, not just from her physician care team, but from the patient herself. It was one of the most remarkable medical journeys I've seen to date.
In Orange County, women of color have higher infant mortality rates and low birth weight births than any other racial or ethnic group. Can you shed some light on the leading causes of these disparities and what steps can be taken to address them?
Absolutely. So firstly, I just want to define for our audience what low birth weight actually means. So low birth weight is defined as less than 2,500 grams or 5 pounds, 8 ounces. Risk factors that can lead to low birth weight include 1, premature delivery. So this could be an unintentional premature delivery. So a woman who just goes into preterm labor before 37 weeks gestational age, or what's called an iatrogenic, which is a medical term meaning an indicated or induced preterm labor for medical conditions that pose a threat to the mom or baby. For example, women can be induced prematurely for preeclampsia with severe features, or if they have multi-fetal gestations like twins or triplets. 2, unfortunately, non-Hispanic Black women are more likely to give birth to babies of a lower birth weight than white women. Research has shown that social determinants of health plays a large part in the prominent racial or ethnic disparity in low birth weight infants. So chronic exposures to stressors such as financial hardships or racial discrimination, pre-pregnancy medical conditions like poorly controlled diabetes, pregnancy-induced hypertensive disorders, poor access to medical care, tobacco use, and environmental exposures are all examples why non-Hispanic Black women are more likely than their white counterparts to have smaller babies. 3. Now, if I remove race and ethnicity from the discussion, although that's incredibly hard to do since there is a national maternal health crisis that disproportionately affects women of color, other reasons for fetal and neonatal growth restriction are as follows. Pre-gestational diabetes, so diabetes diagnosed outside of or prior to pregnancy, poor kidney function, autoimmune disorders like lupus and antiphospholipid syndrome, cardiac or heart disease, pregnancy-related high blood pressure disorders, so gestational hypertension or preeclampsia or eclampsia, drug and alcohol use, multifetal gestations, twins or triplets, environmental exposures, infectious disease, genetic disorders, or abnormal placentas or umbilical veins. Those are all reasons that could contribute to low birth weight.
We understand that hypertensive disorders of pregnancy and diabetes are health issues that disproportionately affect women of color as well, and can lead to poor fetal and neonatal outcomes when poorly controlled. Dr. Beazer, can you discuss these health disorders and their impacts on maternal health?
Absolutely. Counseling pregnant patients on how to manage their chronic medical conditions in preparation for and during their pregnancy is a large part of what maternal and fetal medicine physicians do on a daily basis. Unrecognized or poorly controlled hypertensive disorders is one of the leading causes of maternal morbidity and mortality in the United States. Chronic hypertension is defined as an elevated blood pressure diagnosed outside of pregnancy or before 20 weeks gestational age. Up to 20 to 50% of pregnant women with a history of chronic hypertension develop preeclampsia during their pregnancy. Poorly controlled chronic hypertension can not only affect your heart, but can also affect your brain and kidneys. Pregnant patients with chronic hypertension are also at a higher risk of developing gestational diabetes or poor fetal growth. A recent study was published approximately 1 year ago with strong evidence recommending tighter control of blood pressure during pregnancy. So the goal would be to maintain your blood pressure below 140/90 in order to prevent poor outcomes such as preeclampsia with severe features, placental abruption, which is when the placenta separates from the uterus and can cause bleeding or pain, and fetal or neonatal death. If you have chronic hypertension, it is possible your obstetrician may prescribe you a medication for the first time to make sure you keep your blood pressure under control, or prescribe you a different medication than what you were on before becoming pregnant. We also like to prescribe aspirin to pregnant patients with certain risk factors to prevent development of preeclampsia. Now, on to pregestational diabetes, or in other words, diabetes diagnosed before pregnancy. There is a lot of overlap between the risks that chronic hypertension and diabetes pose on pregnant patients. For a brief overview, type 1 diabetes is characterized as an autoimmune disorder that affects the pancreas's ability to produce insulin and lower blood sugar. So those women typically are diagnosed with type 1 diabetes when they're younger, so children or teenagers. Type 2 diabetes is characterized by the body's decreased response and production of insulin. Type 2 diabetes is also very closely related to obesity and is commonly diagnosed as women get into their 20s or 30s. Ways obstetricians and endocrinologists or diabetes specialists try to keep blood sugars under control in pregnancy include encouraging a low carbohydrate and sugar diet, exercise, or using medications such as metformin, which is a pill, or insulin injections. Diabetes affects the cardiovascular, renal, and central nervous systems. Therefore, uncontrolled diabetes is a risk factor for miscarriage, development of fetal anomalies, hypertensive disorders in pregnancy, low birth weight or excessive birth weight, which is on opposite ends of the spectrum, and the most feared complication, which is stillbirth.
Given the critical role prenatal care plays in identifying and managing health disorders in pregnancy, could you elaborate on its importance and what patients should anticipate during their prenatal visits?
Consistent prenatal care is so important in order to have a successful pregnancy. Prenatal care is a chance for your obstetrician to get to know you and your growing baby. At every prenatal visit, your blood pressure is checked and reviewed. You should try to give a urine sample during each visit to monitor for sugar and protein, which are signs of diabetes and preeclampsia. As you get closer to the second trimester, we also try to monitor your baby's heartbeat, which is typically the best part of every prenatal visit, and using a tape measure to measure from your pelvic bone to the top of your growing belly as a screening for small for gestational age or large for gestational age fetuses. Your obstetrician also reviews lab work that you typically get early in your pregnancy and then towards the middle of your pregnancy. Additionally, there are recommended vaccinations such as the flu, COVID, and Tdap, or tetanus, diphtheria, pertussis, that are protective to you and your baby and can be administered during your prenatal visits. I want to emphasize that these prenatal visits are where you can go to share your concerns about your pregnancy and talk through questions or complaints. Ultrasounds, where you get to see what's going on with your baby and their environment on the inside, typically include an ultrasound in the first trimester to determine or confirm your due date, and then an anatomy scan where we check many of the growing parts and organs of the baby between 18 to 22 weeks gestational age. Prenatal care visits through pregnancy typically occur every 4 weeks until you reach 28 weeks or 7 months pregnant, then every 2 weeks until you reach 36 weeks, then every week until you reach delivery. This is subject to change based on your medical history. If you are considered higher risk, you may require more visits, ultrasounds, and surveillance throughout your pregnancy.
Just shifting gears quickly to postpartum care. Could you explain the importance of what it entails? Additionally, we know that women of color often face challenges in accessing postpartum care. Could you shed some light on these issues and share your insights on how to address them?
So postpartum care may look a little different for every woman depending on their medical history, the nature of their delivery, and insurance coverage. Some elements of the postpartum visit consist of checking your vital signs, a possible pelvic exam to make sure that you have healed appropriately, screening for postpartum depression, and discussion about birth control. Patients with uncomplicated vaginal deliveries are seen 6 weeks postpartum. Those with hypertensive disorders or pregnancy or diabetes tend to be seen within 1 to 2 weeks after delivery to monitor their blood pressure and blood sugar. Patients who have had cesarean sections are seen within 1 week of delivery to check their incision and evaluate their pain. I would like to stress that if patients do not feel well or feel that something's just not right in the postpartum period, to reach out to their providers and schedule a sooner visit or present to a hospital for an immediate evaluation. A lot can happen in the 4 to 6 weeks after a major event, such as bringing life into the world. There has been some push from the OBGYN perspective and also from certain insurance providers to make postpartum visits sooner than 6 weeks postpartum the standard.
As we wrap up our discussion on maternal health, we would like to address the importance of quality preventative medicine and adequate healthcare coverage. So we're going to break this up into 2 parts. You have highlighted so far the significance of both prenatal and postpartum care. Could you also elaborate on preconception care and the value of counseling for women with chronic medical conditions that may lead to high-risk pregnancies?
I absolutely love preconception counseling visits, and I'm a huge proponent for them. I strongly believe preconception counseling is a crucial part of improving maternal morbidity and mortality rates in this country. Preconception visits are discussions with the maternal fetal medicine physicians before a patient becomes pregnant to discuss the state of their chronic medical conditions and what they can do to optimize their health prior to pregnancy. It is a visit that revolves around mapping out a plan to set patients up for a healthy and successful pregnancy and explaining to patients how their chronic medical conditions affect pregnancy or how pregnancy can affect their chronic medical conditions. Sometimes these visits can be very positive and patients are told to just keep doing what they're doing, particularly if their health is in a good state at the time of the visit. Other times, these visits can seem overwhelming because patients walk away with a list of areas of improvement prior to conceiving, which could potentially delay conception. I want to emphasize these visits are not meant to belittle our patients and tell them all of the things they're doing wrong. That's not the goal when I sit down with my patients. Instead, it's a place to discuss what could be better. These visits should be informative of ways patients can take charge of a condition that sometimes may be beyond their control. We often allow patients to share what medical treatments they've tried and maybe aren't currently working for them and ways we can change that. Your maternal fetal medicine and OBGYN docs are your advocates. We want nothing more than for patients to have the pregnancy and delivery they dream of. And when that doesn't necessarily happen, we're there to support them and navigate a more challenging prenatal course.
Thank you for providing information on preconception care and the value of counseling for women with chronic medical conditions. As a healthcare provider in New York State, could you also provide information on the overview of the maternal health services currently covered by health insurance? And then to add to that, what steps do you believe are necessary to ensure that all women, regardless of their race or ethnicity, have access to equitable and comprehensive maternal healthcare services?
So upon talking to our wonderful social workers for our pregnant patients here at University of Rochester, we reviewed what the New York State insurance currently provides for pregnant women, which is routine pregnancy medical checkups, lab work, and access to specialists. Medicaid also covers transportation costs to appointments. Type of assistance can include a bus, cab, Uber, etc., which is largely dependent on the medical needs and accessibility to public transportation of the patient. It covers hospital care during pregnancy and delivery, information about pregnancy, labor, and delivery, HIV counseling and testing, help in applying for other programs such as WIC and low or no cost health insurance for your children and family. Additionally, what's very exciting is that New York State insurance now covers full maternal health care for up to 1 year postpartum, which is huge. It also covers health care for you and your baby for at least 1 year after birth and family planning services. I strongly recommend asking your OB provider or social workers if that is available where you live in New York State.
Thank you so much, Dr. Beazer, for sharing your knowledge and expertise with us today. We appreciate you being a guest on the Healthy Hour podcast.
Thank you so much for having me on your podcast. This is one of my favorite parts of being an obstetrician is talking to patients about taking charge of their health care. And I think there is so much information out there that can really help patients and further prevent or at least bring down the astronomical rates of maternal morbidity and mortality in this country. Knowledge is absolutely power.
All right, everybody, that's it for today's episode on the Healthy Hour podcast. We'd like to thank both of our guests, Chloe Vitale and Dr. Beazer, for joining us and sharing some valuable insights on Black maternal health.
We hope you found this episode informative and helpful. Don't forget to follow us on social media and leave a review if you enjoyed this show. Thanks for listening, and we'll see you in the next episode.